to discuss is very short, only for 15 minutes or 20. So the topic that I chose today is leptospirosis. So for the description of the organism, so the causative agent, we have two main organisms associated with leptospirosis. You have the Leptospira icterahemorrhaeae and the Leptospira interrogans. This organism is a member of the spirochetes. So we have four actually members of the spirochete. We have the first, of course, is your Leptospira. The second one is the Treponema. The third one is the Borrelia, which causes Lyme disease. And the other one is the Spirillum minus in particular, which causes rat bite fever. On the left side, you will see here the Leptospira organism compared against your syphilis organism. So on the right side, you have the syphilis bacteria, or the Treponema pallidum. So this one, as you can see, morphologically they are very different, although they have the same morphological appearance. So the Leptospira is more coiled or more spiral in nature than the syphilis organism or bacteria. So concentrating more on the Leptospira, this is actually a zoonotic disease or zoonotic organism, which means it's transmitted by animals, particularly rats, the domesticated rats, and the what do you call this? The street rats. You also have this in cats, dogs, and pigs. So these are part of their normal flora. So they do not cause disease in animals, particularly rats. So the humans are the only one which gets the disease if they enter the body. So for the mode of transmission, of course, as I've said a while ago, the main vector or the main mammal that carries the Leptospira organism is rats. Okay, so although they are found predominantly in animals, 90% of rats carries the Leptospira bacteria in their kidneys. So as you can see in the cycle, here in the Philippines, the mode of transmission, of course, is the entry of the organism through an infected wound or open wound during floods. So if the person is exposed to flood waters, so that is one way of transmitting the bacteria. So the urine of this particular vector, the rat, will contaminate of course, the flood water, or sometimes the semi-polluted water, so the organism can survive. But the organism again will not survive like the Vibrio in highly polluted water. So the semi-polluted water is one of their favorite types of water in order for them to survive. Once the organism is excreted outside the urine of this particular vector, it will survive for 2 weeks. Okay, so if there is sunlight, the organism will survive only for 18 hours. Okay, for the pathophysiology, again, I've said a while ago, the organism will enter the body through open wound. Okay, so the incubation period is 4 to 14 days. Okay, so in this stage, the incubation period, the organism is in the body, and that's the time it will decide if whether it goes to the liver, heart, or lungs. Sometimes all these parts of the body are infected. Okay, so but the major organ that is affected by the Leptospira bacteria is the liver. Okay, second is the kidney. Forgot to mention there the kidney. Okay, so that's why it's called the 14 days fever or the 14 days infection. For the signs and symptoms, of course, fever is number one. 100% of patients with leptospirosis has fever. Vomiting, of course, and also you have jaundice and headache. So if the patient has history of exposed or waning in the flood, um, that is probably due to leptospirosis or leptospira. So if they have four of these main symptoms, so you have to entertain leptospirosis. So after 7 days, the patient will develop jaundice. Okay, so there is hepatomegaly, of course, because the organism already destroyed the hepatocytes and causing abnormal metabolism in the liver, which causes jaundice. Okay. For the complication, you have the hepatic failure, of course. That is the primary complication of leptospirosis. course, you also have your renal failure, myocarditis, ARDS, or acute respiratory distress syndrome, pneumonia, and aseptic meningitis. Majority of patients, they die because of hepatic failure or ARDS. Myocarditis is only comprises 3% of leptospirosis. The main organs affected are the liver and the kidneys. For the laboratory diagnosis, of course, you have the SGPT, SGOT. As we expect, these liver enzymes are high. Of course, your creatinine, since the kidneys are affected also. So we have here the rapid leptospira test, which is an antibody detection. For, of course, in the case of your myocarditis, CPK, or your creatinine phosphokinase, CBC will reveal high WBC count and segmenters, high segmenters also. For CSF analysis, this is, if you're going to analyze the CSF, there are numbers of PMN, but there is negative culture, so that is called aseptic meningitis. Since the organism is not or do not grow on ordinary media, so we will finalize that this meningitis is called aseptic meningitis. We can rule out viral meningitis because of the presence of your PMN. Okay? For chest X-ray, as I've said, pneumonia, so it's normal infiltration on the lower portion of the lungs. Okay, so you will see the hazy appearance of the lungs of the lower portion, both left or right, or sometimes left or right lobe. So there is the infiltration in your chest X-ray. For treatment, penicillin is the drug of choice for leptospirosis for moderate to severe cases. So patients who are allergic to penicillin, the second drug of choice is doxycycline. Doxycycline is very good against intracellular bacteria and also for spirochetes. So penicillin, of course, is the drug of choice. After 48 hours of penicillin intake, you will see improvement in the patient. Of course, fluid and electrolyte replacement is advised. Dopamine for severe kidney failure. Okay. For the global impact of this disease, Philippines is not the only one that's affected of leptospirosis. The second country that is hit by leptospirosis during the rainy season is India. Okay, so we have lots of cases of leptospirosis in India because you will see in the next picture why leptospirosis is very high in India. So of course, prevention is the elimination of the vector. So I've said a while ago, the number one vector of leptospirosis are the rats. So elimination of the rats, of course, will basically eliminate leptospirosis. In the case of domesticated animals, as I've said, the percentage of leptospirosis in domesticated animals such as cats and dogs are very low. But the problem there is rabies. But in rats that is found in the sewers or whatever, they are very high in carrying the leptospira bacteria. So we have to eliminate the source or the rats in particular so that there will be no leptospirosis. So this is why India has numbers of leptospira cases. They have this particular church that worships rat. Okay? So you have this church, especially for rats. Okay? And also monkeys, I think. They have this church in India that worships monkeys. Okay? So that's about it. Do you have any questions?
Doctor, how about